So good to see you, James and Kevin. And we have David Strider in on a phone call, so you can't see him on the screen here, but I want to welcome all of you just to sit down. I think the congregation is kind of wondering how you're doing in your different ways of caring for people over there at the hospital, whether you're a chaplain or an emergency room doctor or a nurse practitioner. And I just have a couple of questions for you. And I know we're all busy people, and I just want to get to it. One of the questions that I think a lot of people are asking medical professionals right now is, how do you get yourself ready to do your job? How do you get in the right spirit or get your head or emotions in the right place to do what you're doing? And that can be a general question, or it can be related to the virus. James, what do you think of that?
Well, first of all, thanks for inviting us to be here, Ken, and hi everybody. I miss everybody. Kevin and David, it's great to get a chance to chat with y'all also. I think for me as an emergency physician, I went into this line of work knowing that there would be some difficult shifts and some hard conversations sometimes, and that I would be delivering bad news sometimes. And maybe the short answer is that part of what appealed to me about taking care of patients and being an emergency physician in particular was that I thought that I could serve people in my community by being able to be a compassionate soul at the bedside in people's hardest moments. You know, when people can remember the time they went to the emergency department, and I know that sticks out in people's lives. So for me, whether before all this pandemic started, it was on the way to a night shift when I was kind of feeling tired and maybe wasn't super excited about going to work and punching the clock, I could draw upon that knowledge that, hey, this is the way I'm serving my community.
That's right.
And so in a pandemic, it's probably that kind of reminder that I draw upon to keep myself going.
Thank you. David, we know you're at the hospital and there's people around you. We can even hear some of the background noise. That's all right. But how do you answer that question? How do you get your spirit and head in the right place?
Yes, I come to work in the morning, and I always usually get about 6:30 or so, 6 o'clock in the morning, and I first of all, my biggest goal would be to try to treat each patient with compassion, but also try to minimize some of the fear and anxiety about the coronavirus. And then looking at I work in the schedule, and I'm a nurse practitioner in the vascular surgery schedule, and I go about that, and we have about anywhere from 10 to 20 patients per day. We're still seeing emergent patients, and see each patient for what they're here for, try to focus on their needs, but also to try to really minimize their fear of the virus itself. We wear masks all day, so we have to do that, and the patients wear masks as well. But I try to, like James said, try to ad-lib, try to, like the last patient I talked about, the boots he had some Texas boots on and a really neat cowboy hat. And we try to get through things as far as the test. And then let them go. And I'm always smiling. I say, we're going to get through this, and this is why you're here. And very specifically, we'll see you back. You're doing well. We have a few patients we have to admit emergently. And the interesting thing is, with the coronavirus, they've done furlough, and they've laid off some of the employees for a time being because of fiduciary responsibilities. So often we're the ones taking the patients down to put them in their cars because we don't have very many orderlies down there. We're the ones taking the patients up to rooms, which we do. We don't. It's always about the patient, very focused, and that seems to make the day go by pretty quickly. And the patients seem to really appreciate that. We'll get juices for them and so on. So I guess to answer your question, how do I get through each day? It's really trying to take each patient in stride and work through it. As far as that keeps me going, and I usually make sure I always get a lunch break around 1 o'clock or so. Going to the bathroom when I need to, and drinking lots of fluids.
Very good, Kevin. How about you? How do you get in the right space to be a chaplain there at the hospital?
Well, to be honest, some days are harder than others. Some days work well, some days don't. I guess under it all, at some point early in my vocation as a chaplain, people asked me, how can you, like, at a time when I was in pediatrics, people say, how can you work with sick children? And I told them, I don't work with sick children. I work with children who happen to be sick. So for me, is as long as I can see the person first and what's coming along with them is a part of what's going on with them. But if I can focus on the person in front of me, whether it's a sick patient who is having trouble communicating, or a scared family member who may either be in the room or on the phone with me, or a staff person who's just had enough of this day, to focus on the person.
Sure.
Getting up in the morning, sometimes I have to lie there for a while and say, God, I need you to help me manage this day. Because yesterday was pretty rough, and today's not looking to be a whole lot nicer, because it's just tremendous, especially now, there's just tremendous amount of change, and none of it's subtle. There is no soft change right now. Any kind of change is very invasive, very sudden, and very far-reaching, whether it's touching me directly or someone else. We're all affected by it. So again, there's a lot of days that I say, okay, God, it's you and me today, okay?
Mm-hmm.
And somehow or other, I'm surrounded by an astounding number of amazing, gifted, compassionate, caring people who seem to be approaching it in the same way that I am, of trying to see the patient, trying to see the family member, trying to see each other.
James, I got another question for you, and that is, you must have felt some fear around this. I mean, going into the emergency room, did you feel any fear, or did you have, were you focused on procedures? I mean, what helps you deal with some of your fears? And how long have you been an emergency room physician? You've done this for how many years? How many years have you done this, James?
This is a really authentic Zoom session.
That's right. Things freeze
Yeah.
up. Okay. All right.
Yeah, I'm sorry. So I apologize. I think this is a really authentic Zoom session because my computer connection is a little wobbly.
It's all right.
I don't know if you can hear me.
I can hear you.
Now.
We can hear you perfectly. Yeah.
Okay, great. I've been an emergency physician for 21 years, if you include when I started my training. I didn't catch the first part of the question there, Ken.
So the question is about
some
of your fears. I mean, you've done that for so long. I mean, how do you deal with the fears that of being infected, or did you have any fears, or did you just focus on your job, or any? I don't know. How do you deal with some of those fears?
That's a great question. I think I had some anxiety about it at the beginning, before we really had COVID-19 patients, because I was hearing the news reports of what had happened in Wuhan.
Yeah. Yeah. Keep going.
And in Italy, and think that at this point in time, the reality of what we are facing in our emergency department, we have not, is such that we have not been inundated with COVID-19 patients. I guess I don't carry as much sort of personal fear of being infected right now. Though, yeah, it's in the back of my mind in a small way. And I think also, I don't live here at home with anyone who's immunocompromised or otherwise has risk factors. My wife's parents are up in Massachusetts, and so I don't have anybody at home that I would really worry. Gosh, my loved one could get sick if I came home with this virus.
That's good. David Strider, do you have a thought on that? Do you have some fear? You're seeing quite a few COVID patients. Do you have any fears?
I've worked as a registered nurse in the.
Oh, you'll have to speak a little. You have to speak a little
I was
louder.
talking to somebody else.
Yes, can you hear me now?
Yeah, go ahead.
Yes, I work as a nurse practitioner, but also as a registered nurse in the medical ICU. I worked in the COVID unit, working with the help staff nurses directly, dawn and off, on protective wear, working in the unit where they're up to 10 COVID patients at a time. And I asked myself, as the fear is for myself. And I basically look at the precautions. I understand the pathophysiology as best I can, taking very strict precautions for myself, and then making sure that when I'm doing the donning and doffing supervision, I make sure that every nurse or doctor has appropriate gear and go in the room, out of the room, as far as the protocols. I'm also trained. I'm actually in Ebola, so I'm one of the staffers for Ebola. Since our Prosami group in Africa, we have a plan for Ebola, so that's actually even more stringent than the COVID-19. So, having trained for that, so there is fear. There's a fear myself with getting the disease and then obviously dying. But I take very, very severe precautions. Really think about each step before I go would see a patient. On the contrary, one of the concerns I have is when I leave the hospital, I go visit my godmother who's 101 years old, and I have to be very careful, and my mother and other people. So I will literally change at the hospital, occasionally take a shower, and I have a new set of clothes in the car. It's usually a white shirt and dress pants and shoes, a hat. Everything's different. So when I go to the house, I've really just changed everything out. I mean, I did take that very seriously. So I have a plan when I leave the hospital to go see people. I'll be very, hopefully, minimally, minimize exposure. And that's pretty much my plan. It's kind of cut and dry. The first week was very hard, and initially my mother would say, "David, don't come near me," or my wife would say, "You can sleep downstairs tonight." But after we kind of got through that, it seems to be more of a routine now.
Kevin, what do you think? Any fear? You've been the chaplain designated to go into these rooms.
I tell you, the first time that I went through the donning procedure to walk into a COVID room, it was quite sobering. I mean, I'd seen the procedure, I've been trained on the procedure, but to have someone standing in front of me with a checklist and walking me step by step by step through everything and not skipping anything, not rushing anything, and always having to pay attention to everything, was quite sobering. But I don't know about, there's some apprehension, but honestly, a long time ago, I developed a deep trust for nurses and for the physicians, and I've made a real habit out of doing what they tell me to do especially when it comes to how to be physically in a space and so far they've kept me paying attention to what they tell me and doing what they say has kept me pretty safe and pretty healthy for the last 20 plus years, and I have no intention of changing that practice now.
Good. Last question, and that is, why me? Why me? Why am I doing this? Why am I called to this? David Strider, why you?
Yes, for myself, I feel that I've been called to do this, and I feel it's almost an honor because it's initially, after getting through the fear of it, the patients, the families, our communities need guidance, and I get a lot of my guidance as far as the directives from our hospital infection control. As Kevin just said, from the nurse leaders, the doctors that are making the protocols, and I feel so sorry for these patients that it's almost natural to step in and to do the appropriate service. And so I feel very pretty much inclined about that. It's tremendous change in lifestyle because it turns your world upside down. You're wearing a mask, wearing garb, doing your whole priorities are different. Your whole routine is different as far as going into a patient room, how you cluster care and so on. It's a very different way of looking at things. End of life things. How do you, as Kevin can attest to, as far as people not being allowed in the room, telling the family and visitors, no, you can't go see your patient. Sorry, they're by themselves. You may do a video, but what if they don't have internet at home? So just getting through that. But I feel actually almost very honored to be a part of this. I do say prayers every night and try to, and people like yourself and Kevin really try to think about this as far as the purpose. But talking to families and patients, they're very grateful to have other people there and to care. And I've almost found, in working, especially in the new tower and in the MICU area where the COVID patients are currently, there's a very strong teamwork, which is I find almost unusual. From the nurses, doctors, respiratory therapists are all talking to each other. There's no bickering, no arguing at all. And if something's not going well, people say, "How can we help you, David? What can we do to make a better day for you?" And I'm not used to that. I mean, you're working in the hospital. So it's a tremendous amount of teamwork, community that's kind of come out of this, which I find very reassuring. So in essence, I found it a natural calling to do this. It's very different, very strange. I still find it, but I still find it something that I need to do, and I'm certainly very honored to be a part of it.
James Moak, what do you think? Why you? Why me?
Yeah, that's a great question. I think that I'm going to have to turn that question a little bit on its head and perhaps dodge it a little bit.
All right.
I think a lot of what David and Kevin are both mentioning rings really true for me. I definitely don't see that question as why me? Why am I placed in this difficult situation, as much as I see it as why have I been blessed to be able to serve patients at this moment and in their sort of some of these hardest times they have. So I think for me, I feel very fortunate. You asked the question earlier about getting through the day. Well, in some respects, I'm the one person in my household who gets to go see other people and sort of slake that thirst for people and the need to socialize some. So I feel very fortunate. I have a job, and I have a job that is one that allows me to serve people at a time of need. So in terms of why me, I just have to leave that one up to the Lord because I don't know. I don't know. I think one thing.
James, I'll be honest with you. I've often thought if I went into the emergency room for some issue, I would like to look up and see your face.
Well, that's a high compliment. Thank you.
If something happens, I'll be expecting it, and then I'll be expecting all four of you, I guess, all three of you to be there. David Strider, you'll have to crowd in around me. So I have high expectations if I get into trouble. Kevin, how about you? You're the last one to go on this. Why you?
I don't know. There's a sense of me that says, why not me? It all comes back to vocation. At some point, I see James, I see David, I see others around me. I just feel like at some point, God tapped us on the shoulder and said, I want you to go stand over there. I've got something for you to do over there. And there was no why or why not. It's just, you need to go do this. Trust me on it. As you guys were talking, I was remembering some lines of dialogue out of the first Lord of the Rings movie between Gandalf and Frodo. And Frodo said, I wish the ring had never come to me. Gandalf said, so do all who live to see such times. But it's not for us to ask that, it's for us to know how to respond to it. And he goes on to say, you were meant to have the ring, And that makes that's I consider that to be a good thought. I see people who for their lives are like the fire people who run into the burning building while everybody else is trying to get out. I see that metaphorically happening every day here. People rushing toward disaster instead of trying to get away from it. And I don't know, I see that and I feel honored and blessed to be a part of such an astounding group of people in such a terrible time.
Mhm. So I'm going to wrap up our time. Anyone else want to just say something? This is for worship on Sunday, and any other last words to the people at Westminster as they go about their days? Any word for them?
I guess one thing I'd like to say is that I so often hear this term bandied about now, the new norm. The new norm is this, you know, but I just want to underscore that this is a new aberration. And we're going to get back to a day where we can shake hands and give hugs at Westminster and give high fives on a basketball court, or you know, greet people the way we're accustomed to. And I look forward to that. And that's part of, I think, what keeps me going, is knowing that we're going to get back to the old norm. And hopefully it'll be one day soon.
Amen. David Strider, any final thoughts for people at church?
I have one final thought, and that is just this tremendous support from Westminster. I think obviously from you and the pastor group, but folks like Taylor Beard have called, Forrest Kearns, Ruthie Buck, Mark Radsliff, and so on. Just the support for the healthcare providers on the front line, the James, the Kevins, and so on, the people that are really, as well as the patients, the families, the community. It's a very different time. It is an aberration, I would agree, but the support from Westminster is so obvious, and I for me at least, when I get up in the morning, that means a tremendous amount to know that I have friends, spiritual support, as I go in each day. So thank you.
That's great. Kevin, any last thoughts?
My daily prayer is that we can be kind enough to each other and patient enough with each other long enough to get through this together. And who knows, if we continue practicing that patience and kindness, maybe some of it will stay around a lot longer.
Well, thank
Thank
you
you
all.
all.
I'm going to turn off the recording, and I don't want you to disappear yet. We'll talk a little bit more, but I really appreciate you just speaking to the church and connecting with you, and I appreciate your honesty. David, don't disappear with us. We're going to talk a little bit more, okay?
Yes, of course.
All right.